Hi, I'm Roger Giordano. I'm the Medical Director of Henrico Doctors Hospital Inpatient Rehab Program at Parham Doctors Hospital. And I'd like to talk to you a little bit today about inpatient rehab. Our unit, we're in a special situation because being based within the hospital itself, our ability to manage a higher level of medical acuity is somewhat unique for the Richmond area. So we're very aggressive with taking people with medical needs and working through their rehabilitative needs at the same time. We can manage everything from TPN to IV anticoagulation, tube feedings, trachs, any kind of oxygen or respiratory services you may need. We are very comfortable doing that and at the same time managing to get the intensive services people need. They may range from obviously physical therapy, mobility-based issues, alternative means of mobility, occupational therapy, including services that include upper extremity function, but also the cognitive components that go into performing daily tasks. Speech therapy, looking at things such as swallow, cognitive function, syndromes such as aphasia or language-based, apraxia or motor sequencing-based, syndromes of neglect, etc. We're comfortable with most diagnoses, ranging from something as straightforward as a non-elective orthopedic repair, such as a hip fracture repair, to complex oncologic patients, complex neurosurgical patients, subdural evacuations, tumor removals, etc., etc. Oncology patients that are in a gap in their chemotherapeutic regimen, to just general surgical patients and medically complex patients who have had a long and arduous course of acute care stay, usually ICU stay, that has made it necessary for them to receive services prior to being able to return home independently. There are criterion under CMS that we need to meet. Those criterion are not quite as hard and fast as we tend to quote, as the liaisons are obligated to report to the patient and to the referring centers. We do have a 3-hour rule that's part of CMS criterion, meaning a combination of therapy services need to equal 15 hours per week. Ideally, that's done over 5 days, although we do offer therapy services 7 days a week. We do well with cognitive impairment. One of our primary criterion for not being able to accept a patient is an advanced long-term progressive cognitive disorder, i.e. dementia. We will service mild to moderate dementias, and we will service someone with a more significant dementia if their goal is to return home with familial assistance. So in addition to the services we offer to the patient themselves, we're also able to offer family teaching as one of our services. Once again, our primary goal being to return the patient to the community. In conclusion, we have shown a dramatic level of growth over the last 3 years. We've gone from an average daily census in single digits to an average daily census in the upper 20s. We still do have room for growth. We've recently remodeled our unit. We have a large propensity of private rooms now, which is much better for patient satisfaction. But we do have the capacity to take up to 36 patients. We are very aggressive, as I've already delineated, with providing adequate medical care. Our nurses have become progressively better versed in handling the medically acute patient while at the same time providing traditional rehabilitative nursing services. Indeed, these people are amazing individuals because they're dealing with at least floor-level medical acuity while working on constant mobilization, assessment of those criterion that help them go home, such as bowel and bladder, etc. If it crosses your mind that you think they may benefit from services, let us know and let us know early. But we're here to help you move your patients through to the appropriate level of care as quickly as possible to help facilitate getting them back into the community as quickly as possible.